Premenstrual Dysphoric Disorder by Rosalind Andrade. What is PMDD? Premenstrual dysphoric disorder is a severe form of PMS in which the woman experiences a severe form of emotional PMS symptoms, such as severe mood swings, including irritability, anger, depression, anxiety, and this typically happens a week or sometimes even 2 weeks before menstruation. A key memory trick to differentiate PMS and PMDD. PMS equals uncomfortable symptoms, as for PMDD equals disrupting symptoms that disrupt daily lifestyle. So when you're thinking signs and symptoms, you want to think mind plus body. Some signs and symptoms include decreased interest in unusual activities, difficulty concentrating, lack of energy, hypersomnia or insomnia, a feeling of being out of control or overwhelmed, marked change in appetite with overeating, and abdominal bloating. To the right, I included a picture of a woman who appears to be having emotional and physical symptoms of PMDD, as you can tell by her facial expression and her body language. Here is just a picture showing what PMS symptoms look like versus PMDD symptoms look like. If you want to take a moment to read that. The nursing process. What to assess: mood changes linked to menstrual cycle, suicidal thoughts, anxiety, depression, anger, sleep and appetite changes, effect on school, work, relationships, any type of lifestyle activities. Some diagnostic tools used. So PMDD is diagnosed by keeping track of daily symptoms, having symptoms for 2 cycles plus, and then certain tests are done to rule out other disorders before diagnosing with PMDD. Some common nursing diagnoses: ineffective coping, risk for self directed violence, disrupted sleep pattern, and chronic low self esteem. Some nursing safety concerns are suicidal ideations, severe depression, medication side effects, and missed work or school. Planning what the nurse plans to do: patient-centered goals. Patient will verbalize symptom triggers, use 2 healthy coping skills, report decreased mood symptoms, maintain school and work attendance, and remain safe from self-harm. The nurse should prioritize safety, symptom control, emotional stability, and lifestyle support. Nursing interventions. Some interventions include teach sen- teach symptom tracking. The rationale for that is it confirms PMDD pattern. Another intervention is SSRIs, such as fluoxetine and sertraline, which stabilize serotonin levels, and hormonal birth control, which suppresses ovulation, encouraging exercise, which boosts mood naturally, stress reduction, such as yoga or journaling, calms nervous system, nutrition, consuming less caffeine and salt, which reduces anxiety and bloating, and then therapy improves coping and thought control. What to reevaluate: mood before period, sleep patterns, suicidal thoughts, ability to function at school and work, and medication effectiveness. Expected outcomes: fewer emotional outbursts, improved focus, better sleep, stable relationships, no self harm behavior, and increased confidence. Next, some NCLEX style questions. Question 1. Which findings support a diagnosis of PMDD? Select all that apply. A. Symptoms resolve after menstruation begins. B. Symptoms occur randomly throughout the month. C. Severe irritability and anger before menses. D. Depressive symptoms affecting work performance. And E. Symptoms have occurred for at least 2 menstrual cycles. The answer is A, C, D, and E. Rationale for that is PMDD is defined by cyclical patterns, severe mood symptoms confirmed over at least 2 cycles. Symptoms do not occur randomly, so B was or is incorrect. Question number 2. A client newly diagnosed with PMDD is prescribed fluoxetine. Which statement by the client indicates correct understanding of this medication? A. I will only take this medication when my symptoms start. B. This medication helps stabilize serotonin in my brain. C. This medication will stop my period completely. Or D. I should stop this medication once I feel better. The correct answer is B. This medication helps stabilize serotonin in my brain. The rationale for that is SSRIs like fluoxetine work by improving serotonin regulation, which directly affects mood stability. These medications should be taken as prescribed and not stopped suddenly. And that's all. Thank you.